what is the weight loss magic that's new in 2023? And is there any? Well, of course there is. So I'm always delighted to bring you the new anti-aging weight loss secrets that we find. As you may know, my family and I travel across Europe and the United States, always bringing you back the anti-aging secrets that are going to make a difference in your life. I mean, what is life as we get older without vitality and vigor and life? So, what is new in the weight loss in 2023? Without further ado, peptides. Some of you may have heard about peptides and some of you may haven't. When you combine peptides with general weight loss knowledge base, and then you add things like jumpstart juice, shake up that thermostat, get off that plateau, and lose that 10 pounds in 3 days. When you mix these things together, we get an accumulative weight loss success. So, I am Dr. Kelly Birkenstock, for those of you who may not know me, and I am licensed in Louisiana, Florida, and Alabama. I have physical locations in New Orleans, Louisiana, and Mandeville, Louisiana. We travel frequently. Just got back from Clearwater Sunday night, where we performed a lot of different personalized clinics and house calls for some of our VIP clients. We also travel to Mobile, Alabama, Gulf Shores, Alabama, and Orange Beach, and we will be there on the 20th, I believe, 19th, 20th, and 21st of January. So if you need us, we're in town. We're happy to serve you as well. We have our YouTube channel, Dr. Birkenstock Skin Body Health. We've been speaking to you guys about anti-aging, beauty, weight loss topics, menopause, andropause, hair loss, hair restoration for well over 3 to 5 years by now. So if you've missed any of our webinars and you'd like to go back and review them, we're right there for you. YouTube, Dr. Birkenstock Skin Body Health. You can click the description in our link below, and it's going to show you our store.skinbodyhealth.com. We'll be talking about a couple of our products tonight, but we'll also be talking about important scientific information for you. We won't keep you long, but we'll try to give you some knowledge that's pretty important at this point. So, if you've been following any of the weight loss trends, we always try to bring you things that are safe and factual, and not the latest rage that will maybe not hurt you and maybe even hurt you. So if you don't want to jump into a fad that's going to hurt your body, and you might want to consider a fad that's going to help your body, but all in all, when we mix it in with basic scientific logic, then we don't get ourselves into trouble. And before you start anything, please always consult your doctor, especially if you've got any health conditions that you may or may not take medication for. So what are the newest things these days? Well, the newest things these days are peptides. They come in oral, they come in transdermal or patch. They come in things that you swallow, things that you put on, things that you inject, things that you get intravenously. Well, can all of that be safe? Can all of that be right? Could all of that work? The answer is yes and no. Let me explain. For a lot of these peptides, and what is a peptide? Peptide is just a simple word that means it's a short chain amino acid connected with a peptide bond. They're smaller than proteins, but actually build proteins in the body. They're smaller than proteins. They're found in all kinds of cell and tissues around the body. They're used in many different parts of the body for growth, regeneration, repair, and survival of cells. Aside from the natural peptides in the body, there are many peptides naturally found in our foods. So in lima beans, in lentils, in red beans, and many kinds of beans, as well as proteins like meats, tuna, and salmon. Always use your wild catch. Your oatmeal, you're going to find a tremendous amount of these peptides. Well, let's take a look at that. Why would that be so? We know peptides improve cholesterol. So that if peptides are improving cholesterol, we all know that oatmeal pulls down bad cholesterol and improves good cholesterol. So thus we know, without thinking way too far, there must be peptides in simple oatmeal. And there are. Beans as well. Tuna as well. slim beef, chicken, turkey, poultry, fish as well. So eat as much as you can, because that's going to give you your natural, organic way of getting some extra peptides in the body. And they will help you build and bulk muscles. They will help you regenerate. They will help you heal if you've got any injury. And they are often used to optimize performance. So let's then move on from the natural ways we can get peptides to the other ways we can get peptides. So do I believe in a peptide that we swallow? Not so much. There may be one that is outside of the normal realm. However, by and large, they can't break the barriers in the body that they need to get into the cells to actually do the work of angioneogenesis and lipolysis and the inhibition of lipogenesis. Well, what does all that mean? That means they can't block fat, build muscle, and build new blood cells and blood vessels that are going to regenerate and heal things throughout the body. So I'm not really big on oral, although there may be one or two that you might introduce to me that may be different. I'll give you an example. Benadryl. Benadryl is a over-the-counter product that most of us know is available for sleep and many of the sleep aids. And it's also used as an antihistamine for cough, colds, flu. And it's also used in a cream for itch because it's an antihistamine, and histamine is what makes our skin itch. Benadryl. It does cross the blood-brain barrier. How do we know? It's one of those few medications or things in life that do cross the blood-brain barrier. Because of that, because it crosses the blood-brain barrier, it makes the majority of people very sleepy, and it makes some people wide awake. That's just a few that have a different receptor. So diphenhydramine, otherwise known as Benadryl, is one of those things that we would love to continue to make with good stuff because it crosses the blood-brain barrier. Then years later, Claritin and Allegra came out for allergic rhinitis and itching and rash and other things. Why? This product, Claritin and Allegra, or loratadine, did not cross the blood-brain barrier. So it didn't make us sleepy, it didn't make us hyper, and we could take these products and not itch, and not be sneezing with a runny nose, and go to work peacefully. So that's one of the opposite things what we're talking about. In general, most things don't cross the blood-brain barrier, and that's why when you've got something like a meningitis or an infection of the brain, you have to have IV antibiotics. Because when you swallow an antibiotic, they go throughout the body, but most don't cross the blood-brain barrier. So if you had a brain infection, it wouldn't be able to help you. We're going to bring that forward to what we're talking about today. We're talking about peptides for weight loss. So most peptides that you might swallow do not get into the barriers in the cells in the body to be able to break down fat, build muscle, and therefore might not help us as well as we thought. So therefore you want an injectable, sub-Q, which means right there in the tush or right there in the abdomen, just beneath the skin. And you're getting the peptide right where that solution needs to be, in the subcutaneous tissue or in the muscular tissue in the hip. Could you also do it IV? Absolutely. But then when we do something IV, we run the small risk of getting infections and needle issues, and we also don't want to blow a vein. So when you're doing too much to a vein too often, as the people know who live with chronic diseases that have to get IVs all the time, you wind up blowing the veins, and then the veins are not usable. That's not on an everyday basis if somebody's just doing something once in a while, but it is something to know about and to be aware when there's a much easier form of transmission. Please, if you don't mind, like and share our videos. We love when you share our videos. It helps us to be able to deliver to more people across the nation, actually internationally, because we do have people from Greece, we have people from Italy, France, and Germany that listen to our webinars, and we so appreciate you. Hi this evening. So glad you're here. So anyway, if you would like and share, we'd love for you to be a part of us. We are happy to send out to you a bottle of our Jumpstart Juice. Jumpstart Juice is a weight loss plateau breaker no matter what diet you're on. It cuts appetite. It fills you up totally with vitamins and minerals, and just as a deal breaker. Most people lose up to 10 pounds in 3 days. There's no side effects. There's no amphetamines or any other medications in the product. And it's just been a delightful thing. It's vegan, full of prebiotic. Prebiotic is the precursor to probiotic. So it's going to fill you up with those fibers and help you fertilize your probiotics within you. What's new in 2023? Our weight loss bundle. So Jumpstart Juice, CLA Burn, and Carnitine. These are all oral things. They're not peptides, but what you can do in an oral state to help you to lose weight. Those are originally $175. They will be $149. The combination is usually $175. They will be $149 for the next 2 months. Let's get us right through Mardi Gras. For those of you who aren't from Louisiana, in Florida it would be Gasparilla. I'll be down there with you guys during Gasparilla. So Gasparilla or Mardi Gras, we're going to go right through there. We're going to bring it all the way till March 1st. So through March 1st, CLA Burn, Carnitine Burn, and Jumpstart Juice, normally $175 will be $149 for that What's New 2023 weight loss bundle. So we're happy to have you there. In terms of peptides, there are several peptides, and the peptides that are safe for weight loss, in my opinion, are semaglutide and tirzepatide. If you go to a pharmacy, you can get some of those substances as Ozempic or Mounjaro. As any of you that may know about these products, they've been on back order. These prescriptions have been on back order for the greater part of 6 months for semaglutide, Ozempic, and 3 months from Mounjaro, tirzepatide. So those are the two weight loss peptides that have stood the mile above the rest. There are other ones as well, and they're fine. They are good, but they don't help you lose quite as much weight as these two do. The tirzepatide, which we have available for you, those studies are showing greater than 20% weight loss in a period of 6 months. The semaglutide is showing, via the studies, scientific studies, peer-reviewed studies, 15% weight loss in a 6-month or more study. So those are two right off the cut that are wonderful. If you're able to get them because you've got the diagnosis of diabetes or something else that they will pay for, they mainly only pay for diabetes, and the insurance companies or very much pick and choose which ones they will cover, if they will cover it. If they do, great. Take your prescription, go to your pharmacy, and get your prescription. If you don't, we've got a plethora of people who are just desperate to get these, and they're so safe. There's a side effect with every drug we put in our mouth, and we know that. But by and large, once you've checked out the patient's history and asked them about their family history and gone through what medications they are, these peptides are pretty doggone safe. And so we're able to offer them to you in our clinic. Just give us a call and let us know, and we're happy to help you in any way that we can. So they kind of down-regulate the secretion of glucagon. Thus, they prevent the glucagon conversion to glycogen, then converting to glucose. So therefore, the sugar's not floating around the body. When the sugar doesn't float around your body, you don't build the fat cells that build the cortisol surge, that build the inflammation, that build the weight gain. So that's why these things work. And the half-life is wonderful. For the two peptides I'm discussing tonight, the half-life is a week. So therefore, you only need a little tiny pinprick. It's not even a long needle. It's shaped in the form of a pen. Click and go. It's that simple. And when we click and go, we're getting a dose of the peptides that will stay in our system and block hunger and slow down gastric emptying, which makes us feel full longer for a full week. So we're talking about a 1 week display or 1 week of entering into the body, not having to fool with it for a whole nother week. So it really does bring something new to the table. It inhibits fat building cells. It exaggerates fat breakdown cells, and it also helps build muscle through the myocytes or muscle cells, and it targets adipocytes or fat cells. So it really can be and is a game changer. It helps keep your physique slim. It works on such hormones such as insulin, which are responsible for keeping blood sugars low. What do we want in our blood? We want our blood sugars to be low. So it helps us really maintain a state where we're not craving. When you're not craving and you're not over ingesting bad fat calories, bad carbohydrate calories, we can help you maintain that weight. One of my other favorite peptides is 5-amino-1-MQ. 5-amino-1-MQ. Why is that my favorite? It's a derivative of methylquinolinolone, and it is potentially going to be used a lot for weight loss. But what does it currently do? It blocks N-methyltransferase, which is NMT. NMT stops the breakdown of nicotinamide, NAD, and increases NAD. Any of you who have listened to my prior talks, NAD is a game changer. It is an anti-aging, brain reboosting, brain rebuilding peptide. It's absolutely wonderful. Can't hurt us, can only help us. May help us lose weight, but we already know it has some Alzheimer fighting principles, cancer fighting principles. It's absolutely a game changer for anybody who may have addictive issues. That NAD rebuilds the brain, and then you're not craving. So if it helps you not to crave addictive things, and it helps the brain repair from things like Alzheimer's and Parkinson's, suffice it to say, they're studying it now to see if it can reduce the cravings in cravings for carbs and fats, which I feel pretty sure they're going to find out that it does. So, if there's any questions, we'll open it up. Peptide, that's what's new in 2023. Can you get them orally? Yeah, but they usually don't work. Can you get them in a patch? Yeah. Haven't seen much work transdermally or patch on the skin either. So sub-Q, little poke in the belly. IM, little injection in the tush, or IV. I don't recommend the IV for certain reasons. I don't think a lot of IV is good. There's so many other ways to get it in a lot more easily, and I think it's safer. Peptides are just the greatest options for weight loss, and they just they have so many anti-inflammatory properties. They build stamina, endurance, and muscles. So I think it's just a beautiful anti-aging product of the future.
Do I need to make an appointment to get these injections?
Yeah, you would need to make an appointment. We can talk teleconference. Love to see you in-house, and just make sure what you're on. So, of course, a diabetic type 1, and in case you didn't know that, diabetic type 1, this would not be a good idea for them. Diabetic type 1 are the young people that usually get diabetes, and they must take insulin every day of their life. It's not the type 2 diabetic adults that get type 2 diabetes over time, and thus can use a lot of orals and or injectables and or peptides, as we're talking about today. So please like and share our video. We'd love to have you on board for not only this video, but any of the ones in the past and any of the ones in the future. We're happy to send you a bottle of our Jumpstart juice. Well, this is as seen on TV. It's had trajectory since 2016. Can't keep it on a shelf, so one of our top sellers. You mix this with your peptides, and you've got a home run for weight loss, at least the beginnings of it in 2023. And if you've ever heard me speak or talk to me in person, you know I always say, take the fad, take the peptide, do a little Jumpstart juice to break that plateau, but then let's get down to science basics. Let's do your DNA. Find out how you're built so that I can guide you properly in your weight loss and maintenance for life. No more yo-yo dieting. Let's look at your food allergies. Because if you've got food allergies, and not the ones that close your throat, but the food allergies that bloat you and turn on the cortisol and make you gain weight via the cortisol pathway, Let's turn that off by finding out if it's red beans or garlic or garbanzo beans or apples or whatever it might be that you have no idea that's turning on your inflammation pathway. Let's look at your hormones. Are they crazy wild? Are you perimenopausal? Or are you a male over the age of 40? When we get those hormones in check, the weight flies off. When we put it all together, that's the wheel of fortune. That is the humble wheel of optimate weight loss for life. So I'm Dr. Birkenstock. It's been a pleasure speaking with you this evening. Again, I'll give you some of our numbers. We're at 985-727-7676. You can text or call that number, 985-727-7676. Our website is skinbodyhealth.com. Feel free to go in there and click Contact Us, skinbodyhealth.com. Also, if you want to email us, we're going to give you every way to get to us. info@skinbodyhealth.com. info@skinbodyhealth.com. Phone number one more time. Everybody says I don't repeat it enough. 985-727-7676. You've been a wonderful audience. It's our pleasure to speak with you always. Thanks for being with us. Please hit subscribe so we can become more popular on YouTube. Take care.